Hello everyone, my name is Dr. Ziaur Rahman. I'm working with Thumbe Hospitals, Hyderabad. I'm an orthopedic surgeon and joint replacement surgeon. Today we'll just speak about the common myths in the knee replacement. We have been seeing lots of myths in the population regarding knee replacements. People who want to undergo knee replacements, they feel kind of unsafe, or they have plenty of questions in their mind, they have plenty of doubts in their mind regarding knee replacements. They come around with plenty of doubts and things which I commonly face, and like I've answered to my patients, and like I just want you to elaborate these things for the benefit for all. The common questions what I usually get is like, how long is the knee going to last? The knee is going to last around 20-25 years based on your kind of activity. It is not, it's a kind of dimensions what the amount of length of the years what we give. It depends on the patient to patient. If the patient is heavy built, has got a very smaller lifespan, the patient is lighter, has got a low body weight, then definitely the chances of survival of the implant is much higher. Apart from the survival of the implant, the most important thing is the usage, the amount of use what you do. If you're doing repeated heavy activities, it is going to last for a small time. It's not the implant which is going to wear off. It's an insert. It's a small kind of a plastic material which is especially placed in between your upper and lower implants, which helps in articulating your bone, the knee. This goes out. Usually, it's kind of very good material. It's kind of very high density plastic. It doesn't wounds off that easily. But most of the times, if patient is heavy built and they have these kind of heavy workers and all those things, it lasts for almost 15 to 20 years. That is a lifespan. The other common doubt people have is like, how soon will we be able to do their normal activities, day-to-day activities. It is usually seen patients will be made to walk immediately next post-operative day. They can walk with a walker, and the first post-operative day they can do their normal activities like going to washroom and all those things right from day one. They can start bending their knees. They can put full weight on their knees, so they do not take any kind of help from the attenders and all those things for just doing their normal activities. All they need to do is like carry a walker for a certain period of time till the pain subsides. And the other question, the most common question what I get is how painful it will be. Usually it is a very kind of an painless surgery because we do give a kind of an analgesia. The anesthesia what we give is kind of epidural anesthesia which lasts for almost around 48 hours. Then you have to they give a small dose of injection which lasts for 48 hours, so you will be pain free for 48 hours. So you can move around, you can do your normal activities. So mobilization or walking is not an issue at all after knee replacement. The third thing what I face is like how often you have to come and visit your doctor. After knee replacements, usually you need to visit your doctor for 3 or 4 visits, just to see how your wound is healing, and like you have to come for a suture removal. And apart from that, you have to come and see him on a monthly basis just to show him how well you're doing with your knee. The most important part for knee replacements or knee replacement surgeries is the rehabilitation or the exercises which we do after the surgeries. Rehabilitation is a very key important aspect of your surgery. The success and failure of the surgeries most of the times depends on the rehabilitation, how well you do the exercises. By doing the exercises, your knee gets strengthened up, your muscles surrounding your knee get strengthened up, so that you have a better results. The other thing is like people ask about the implant quality and the flexion. Flexion depends upon how was your pre-operative range. What was the range of knee movement what you had before your surgery? If you had a fairly good amount of knee movement before the surgery, definitely you will have a better movement or almost equal movement after the surgery as well. So it all depends on how bad was your knee before the surgery. The most common complications what we face around is infection. Infection is the most common or dread complication what we see in knee replacement patients. It is usually seen in about 1% of the patients who undergo knee replacement surgeries. We do take all kind of precautions to avoid infections in the patients. This is ranges from the antibiotics to the OT procedures, sterile procedures what we follow, but apart from that, like, it is very difficult. The most the most common thing is about the cost of the surgery. It depends on what kind of implants we are choosing. You have a wide range of implants which is available in the market. You have implants which gives kind of a high degree of flexion. You have implants which have got a different coatings. You have implants with a gold coating. We have got implants with a different metal coating which proves to be saying that like they last much longer rather than what it is meant to be. So you have different varieties. So it depends on your structure or what grade of arthritis are you. Based on that thing, you can choose your implants. So there is something called as a partial knee replacement, where you not undergo the entire knee replacement, where only one part of your knee gets replaced, only the damaged part gets replaced, the other normal part is left around. So that is all. Hello everyone, my name is Dr. Ziaur Rahman. I'm orthopedic surgeon. I've been trained in arthroscopy and sports medicine. Been doing quite of good work in sports medicine, especially the shoulders and knee arthroscopies. We are doing quite of significant work with shoulders, rotator cuffs and bank arch repairs. Apart from that, like, we are doing keyhole surgeries for knee also as well. We are doing lots of work for stem cell replacement therapies. I've got my fellowships from UK in joint replacement and revision joint replacements. So I've been doing lots of work in that field as well. We are doing significant work in knee and hip replacements, where we're doing computer navigated knee and hip replacements with the state-of-art facilities. We have been doing kind of custom-made prostheses and complex knees and complex hips, where we do revisions after maybe like around infected knees or infected hips, which undergo second surgeries. We are doing lots of that work as well. Apart from that, we have been doing lots of work in the field of tumors, where we have tumors of the bones, where we have to replace the entire bone. So it's called as a custom-made prosthesis or musculoskeletal oncology work we have been doing, where we have quite a significant work with doing custom-made prosthesis in these fields as well. So you can approach us if you have any kind of queries, if you have any kind of opinions. You can always approach us for this thing. You can contact me on my appointment numbers. You can get an appointment and just visit me. We'll sit down and clarify whatever doubts you have. Thank you.